Joining me today is the chairman of Maxicare, Bobby Macasaet. Bobby, so great to see you again.
Hi, John. It's been a while, but you look good.
You look good as well. The
Thank
last
you.
time we were together, it was in a park in Makati. It was at the Salcedo Park, was it?
Legazpi.
Legazpi Park. Right. I remember that time. We had a very quick tour around the Sunday market.
Yes.
That was quite an experience going around that with you. And then after we grabbed a coffee and we headed to a bench in the park to talk about everything from life, business to your experience having lived and survived cancer. So I want to get into a lot of that with you today. But first of all, I want to find out, how are you doing?
I'm doing good. Taking it one day at a time, trying to really work as hard as I can to keep Maxicare a relevant player in the healthcare industry. We have enormous opportunities, enormous challenges. We really see a really potentially great future for the company. So I'm excited about it all. So
So are we. I mean, you're talking right now about the future, but before we get there, I really want to get into the past,
okay.
like how everything started. Because you see Maxicare right now, it's such a big business. It has touched the lives of so many people. But how really did Maxicare start at the very beginning? What were your memories of when your father started Maxicare? I'm sure back then it was just, a fledgling startup. How did things materialize into, a business that eventually, will turn out to be what it is today? Like, how did it start really, from your recollection?
The vision of Maxicare was really the vision of my father when he really, as a medical professional all his life, he really believed that good quality healthcare should be available to as many Filipinos as possible. As a result of his work and studies in the U.S., he and a group of his doctor friends, they were able to get a sense of what the health insurance industry in the U.S. was like back. We're talking in the early 80s, and so he realized. He said, the HMO model in the US could certainly be, he believed, applicable here in the Philippines. It's something that drove him to bring together a group of his doctor friends and with the help of a few businessmen to found Maxicare in 1987. For the first 10 years, they were just basically on their own. The industry was fledgling in many ways here in the Philippines. The market or the reception was still very cautious, because when you buy a Maxicare plan, you basically buy a plan you pay in advance, and you may not necessarily have to use it for at all.
Right.
Right?
It must have been such an alien concept that time.
Yes, that was the big challenge for them to educate the market. Most people don't think about healthcare until they're sick. They may just go about daily life, and then all of a sudden, when a situation comes up, there's either a chronic situation, that's when they say, oh, okay, I need to find some funding, or I need to take care of myself. I need to go to a hospital. And usually, unfortunately, at that point, that's really the worst point. You are already at a stage where you've been carrying this condition for a number of years. You may have ignored it or not thought any beyond just, okay, I feel okay, right?
Yeah, that's the thing though.
Yeah.
Your product is something that you hope you will never ever use.
We encourage our members to avail of the benefits of annual checkups, because once they have a sense of what their conditions are early on, they can begin to take steps to treat it, to change your lifestyle, and you want to do that. And certainly there is a cost to that, right? But it's a lot less compared to when you find out you have diabetes or hypertension, and then you are put on medication for the rest of your life, right? So if you can address the symptoms early on, determine what the root causes are of your condition, that's a lot better than waiting until you're really in the situation where you have no choice. There are benefits in each of the plans that allow the members to go see doctors and find out. So take advantage of that.
I really want to find out how you grew up also learning, observing from your father, his colleagues, the business. Like, what were the early impressions that made on you?
I would ask him sometimes, or he would when he would come home, and if Maxicare was on his mind, he seemed to be a little frustrated. But he was always a believer that good marketing was an important step for the company to prosper and to grow. And as a way of doing that, they really focused on making the services from doctors and hospitals and clinics available to as many members as possible in as many locations as possible, because that was the sort of the carrot. No, you buy a Maxicare plan, you can see, you can go into the any of the top hospitals at the time. You can see multiple numbers of doctors in many different locations around the country. And there are other clinics if you choose, if it's more convenient for you to visit a clinic. So, and really, it was just a question of promoting the service of Maxicare in a way that would convince existing members and potential members that this is a good plan to purchase because it will make all this medical service accessible to you. So I always remembered that having the ability to go anywhere at any time at a convenient hour, hopefully, was the way for our members to be able to see the doctors and at the same time give them confidence that Maxicare was always there for them.
It's intriguing to me how, when you said the things that you remember sometimes when he would come home and he would be thinking about the business, he would be thinking about Maxicare, and he would be maybe frustrated, right? I think that's true for a lot of businesses. That if you're trying to solve a big problem, or trying to create something that's going to change people's lives, I think there has to be also that struggle, because it's such a difficult thing to do, right? It's such a difficult thing to build. In this case, a business that hopefully will touch more lives. You said that there were frustrations, but is there a conversation in particular that stands out in him serving as a mentor to you, as a guide, and someone who is passing something on?
I remember more than once he would always say that you're going to be faced with having to make decisions, right? And sometimes the decisions are might not necessarily be comfortable or what you exactly think it should be. But the important in his mind and his belief is that let's make a decision. Okay, don't delay. I mean, study all the factors, but in as best you can. But ultimately, make that decision that you're being asked to, because he was not a businessman in training. In most of the areas, whether he was in Makati Med or in Maxicare or in other family-related businesses, they always looked to him to head it because he was not afraid to make a decision or take a certain risk if necessary. That's what I kind of took away from him is look at all the factors as you can, whatever inputs you can get, and you may not necessarily have all the information you need, but ultimately you have to make a call, and it takes a lot of strength, and not everybody's going to be happy with that decision. So you just have to, but you have been tasked as the head or as the leader to make that call.
And
So
it's been said that, leadership, true leadership, is not about wanting people to love you. It's about making the right decision.
that's true. Believe me, I know. He passed away last year, and a lot of his friends who knew him well used to tell me, "Oh, whenever your dad sometimes made a decision, a lot of people were unhappy. They didn't like him, or they hated what he did. But he stuck to his guns." And I said, "Well, that's what he was like. He felt the courage of his convictions, no, and sometimes, yeah, not everybody's going to be happy." I think that that's one of the things I really took away from more than one conversation with him.
I think looking back, the business started in the 80s. I'm sure it has evolved so much from what it was before, even the kind of culture within the company, also people's beliefs and what they know about insurance. Would you think your father would be happy with where things have gone from where he started? Do you think that where the business is now is something that he's always wanted for it to go to?
Absolutely. From where we began in the early 80s, and even, maybe the first 10 or 15 years of the company, to where we are today, it's a completely different situation. But I'm sure he's wherever, up there, he's looking down at it, and he's smiling away at how Maxicare has evolved from a fledgling operation run by doctors and a few businessmen to a really large, successful and growing organization, no? Still within, or not deviating from its roots, no, of making healthcare affordable to as many Filipinos as possible. The opportunities are really, really immense because, we have a huge population, not exactly the healthiest, but so there are real opportunities, and I know that he's very, very pleased with what Maxicare has become, and will hopefully uh, grow moving forward, with new leadership and a solid shareholder base.
I want to now get into what happened, like in terms of the growth of the company. There's this African proverb that says, if you want to go fast, you go alone. If you want to go far, you go together. In this case, you were able to really convince a lot of other stakeholders to be part of Maxicare, this Maxicare journey that you're undertaking now. Talk to me about what it took to be able to decide that, yes, we're ready to seek outside investment. We're ready to work with other, I would say, bigger, perhaps, corporations. What was that journey like in terms of starting out as maybe, more of a family owned and operated business into something that will not necessarily be easier because you have other people, other stakeholders to involve, but obviously now we see, the growth made possible by this.
As a fledgling operation, you're basically, and of course, a new concept, right? You're kind of learning as you go along, right? And a lot of mistakes, or a lot of, not necessarily the right moves in the beginning. But I think what my father always believed, he didn't see himself as knowing all the answers. In the first 10 years of the operation, it was just them, the doctors and these businessmen, and they were fledgling, really, just trying to introduce a new concept. When they realized that they needed more capital and more expertise, they were not afraid to do that, to sell a stake, significant stake, to the right investors, which they did. No, in 1997,
1997,
yeah,
they already accepted
the
investment.
entry
Okay.
of PCI Bank
Okay.
and Cigna, the global insurance company. From that point on, they were able to at least take advantage of the networks that these new investors provided, and that certainly contributed to the growth of the company. And at the same time, I think people began to realize that, in spending ahead, purchasing a plan, even though you may not hopefully have to use it, and hopefully you would renew it a second time. And at that point, a lot of companies, foreign companies, were already beginning to invest heavily, coming into the Philippines, and in particular the BPO industry, where they had hundreds, if not thousands, of employees scattered all around, and they were looking for affordable healthcare to take care of these people. And so the growth, not just of Maxicare, but the entire HMO industry, really began to take off in the early aughts, no? With the entry of these foreign companies. What happened was the local companies realized, oh, these companies are offering healthcare coverage for employees, right? And that was quite attractive to bring in a lot of smart, young, hungry employees. So The local companies who may not have necessarily, for all sorts of reasons, not offered these healthcare benefits began to reach out to the HMOs and ask,
They were reaching out to the HMOs that
yes,
time.
yeah,
Okay.
and of course we marketed to them as well, right? Because we knew that certainly the foreign companies had coverage, right? But a lot of local companies were they self-insured, or they had their own process for handling whenever an employee got sick or needed a major procedure done. But they began to realize it's a smart thing to invest in our employees by providing them with a very secure, a very good healthcare plan. So that was the beginning really of the growth of Maxicare in the industry as a whole. For a 2-year period, from about 2006 to 2008, as a result of, again, some changes. So I think Cigna made their own global decision to divest their stake in Maxicare because I guess they felt they had other priorities. They divested it. PCI Bank acquired it. Again, PCI Bank provided, through their own network, senior managers to help run the business. And at that point, it was my father and Mr. Tong Puno, no, who was a banker by training and by work experience, who basically ran the company together for that 2-year period. Mr. Puno, who I spoke to recently, just was saying that even then their mentality was, we're still small business, right? And so we need to like make decisions, or we need to, and they were basically left behind. They were left. The big investors just said, you guys run it, you take care of it. And so the two of them just basically worked closely together to keep Maxicare growing. And as a result, uh, in 2009, if I'm not mistaken, PCI Bank was acquired by the Equitable Banking Group. And that began, I think, was really the takeoff portion where Maxicare really began to make a name for itself in the industry with the help of Mr. Tony Go, one of our largest shareholders. Because when BDO acquired that stake, or subsumed or merged with Equitable Bank, the Maxicare investment was something that it was not in their portfolio, and they were not really willing to hold on to. And so Mr. Go stepped in and bought that entire stake. And from that point on, he was very much involved with the day-to-day operations of the company, alongside my father and Mr. Puno. And that really began a really exciting time for Maxicare because Mr. Go had a lot of experience with technology, and so we were able to adapt procedures and processes that allowed us to really uh, become a little more efficient, and to understand what there was lots of information that was coming in about our members. And so we were able to at least get a handle on really what do our members need? What are they looking for? Do they want more hospitals? Do they want more clinics? That really allowed the company to seriously grow because we really focused on just being an efficient service provider to our members.
Right. Because you mentioned in the early days it was all about marketing, awareness. Now you're at a stage where it's about processes, it's about making sure that there's efficiency in the already now much bigger company.
Yes.
What's that like in terms of the business, the focus of the business and the focus of the leadership?
In essence, our management really had to become more detail oriented because the process of from when a member feels something, right? From that starting point to when he or she gets treatment is one phase. And then there's the phase where when all of that process gets going, ultimately, if he or she uses either a clinic and then goes to the emergency room or has a procedure done in the hospital, there's a claims process that has to be handled efficiently from our providers, from the hospitals and from the clinics. So that's second step. We really just focused on making sure we could give comfort to the member by explaining the process. And we're talking still basically on the telephone. I mean, the internet was already there, but as you know, you're aware, Filipino culture, they really prefer talking
They
to a
want
human.
someone on the other end,
Yeah,
right?
and so as much as Mr. Go wanted to shift that direction, it was an enormous challenge because we were getting huge volumes of calls, and so as the business grew, we really had to figure out ways to just process all this activity and all this information that was, and making sure that whatever it is we provided to the members in terms of information was accurate or is accurate, right? And convenient, right? Because they're not feeling well, they need I need meds now, or I need to see a doctor right away. And so you want to make sure that the service is available in a timely manner, and which is ultimately why we decided maybe 5 or 6 years ago to just put up our own primary care clinics and just make that available to the membership, give them an option as opposed to having just to go to an emergency room in a hospital or in a third party clinic. Enormous challenge again, because it's growing, it's really growing. And yet we want to, we see occasional bottlenecks in the more popular locations, so we want to figure out how to ease those bottlenecks. And that's all technology driven now. And so we need to, you need to have a back room, if that's the right word, where all this information is processed efficiently, quickly, and gets to the right people within the organization who can make the decision, and who can pivot or change if one thing's not working. And okay, we have to do something different, and all got to be done. Boom, boom, boom. Otherwise, you have unhappy members, right? Or why am I sitting here for 30 minutes, after I've registered? And so it's still an enormous challenge, but it's I believe we're getting much better at it compared to the hospitals, I would imagine.
I would imagine also that you're in an industry that is so conducive to frustration. You talk about the travel industry. Obviously, if you're an airline, you will never be able to please everyone or anyone. Same thing with healthcare, right? And so I'd like to know, being in your business, your line of work, what has been the biggest challenge being in this industry and doing what you do?
Ooh, that's a big question. Um, Frankly, if from where I sit, there are really two things, and they may be, they're probably related in some way. Number one is managing expectations of our members in a way that, as you said, at a time of stress, pain, anxiety, right? We have to make sure that we are there to help them get through this situation. Now, the second thing is, in order for us to do that, we really need to have again, I will go back to that term, a backroom operation that can clearly provide our managers with the right information to help them make decisions that are in the best interest of our members and, of course, of our company as well.
So I want to now ask you at this juncture. Last time I was in your office, I think it was about a year ago. Things have changed. There has been, I guess, a reorganization. And, as with any big company, that's always a challenge, right? We talked earlier about, you know, you now meeting new people within the organization. You're the chairman, so you don't really have to be here. You don't have to be here every day. You're not actually managing. You don't have to manage the company. But as someone who is looking at the big picture, what are your thoughts on the future of Maxicare?
Okay. On a personal note, I I want to ensure that my father's legacy of making healthcare, affordable healthcare to as many Filipinos as possible is continues. And so, which is why, as you said, I don't necessarily, I'm involved in day-to-day management, but I'd like to I allocate a lot of my time to talk to our managers, to attend important meetings, and just listen and occasionally contribute my 2 cents, no? And at the same time, the future is really wide open. Why do I say that? We do have a population that is not the healthiest. There's an enormous base from which primary care can be offered, and at the same time, you want companies to understand that offering competitive and well thought out healthcare plans to your employees, to your executives, is the right thing to do. And the industry is really poised, I believe, to grow significantly, taking advantage of various factors that I've just mentioned. You know, the population, the opportunities for companies to provide healthcare for their employees, and it's not doesn't come without challenges, but I see really a bright future for healthcare industry, for Maxicare and the HMO industry as a whole. Now, things are not the same as they were maybe 30 years ago when the company started. We have to be nimble enough. Our management has to be able to spot these trends early on and adapt our business model to take advantage of the opportunities that are provided. There are really 3 areas that we're looking to focus on moving forward. First one will be to develop real expertise to be able to directly offer our products and a whole set of new products to the consumers. For much of Maxicare's history, we have been focused on large corporates, which is fine. We have relationships with companies for more than 30 years. But the future really is an opportunity to sell directly various products and services to the consumers. And that requires a real difference in marketing, in product development, in operations. And given the way individual consumers now have the ability to buy and sell, on a little gadget in your hand, right? You can address that and make sure that you want to be in that space, right? So that's one area. The second area is, of course, all of this again goes back to that back room. Our IT systems have to be top of the line. And what worked maybe 20 or 30 years ago may not necessarily work today. So we have to adapt and we have to evolve and we have to make sure that we are able to process enormous amounts of data, because it's really the data. Once you have it there, you could have it in a server, but you kind of look at it and say, what does this all mean? Right? And hopefully we are able to harness the abilities of data scientists that we hire to help the management decide, okay, what should we sell to a middle class family in Cebu? Is it the same thing that we offer to the same middle class family in Davao? Or is there some difference that needs to be addressed, or that we can offer a different product, a different service? And all that requires analysis and data. And so we are also focusing we are making currently enormous investments in upgrading our information technology systems. Finally, something I mentioned earlier to you is we are going to expand the number of primary care clinics.
That's been amazing, that growth. I see sometimes because I get your emailers, And it seems to me that that growth has been really exponential.
It's been a learning experience at the same time for us because we initially we started maybe 5 6 years ago with the first few clinics, uh, roughly 200 250 square meter spaces we were looking at, and now all of a sudden we realize that's just not. We need bigger space.
Okay.
We need bigger space because if you want to provide a real full service clinic, you will need space for an MRI machine, a CT scan machine. You need to expand your laboratory to be able to process all the specimens that are left there, and so we are embarking on an enormous push to identify locations nationwide with the space requirements that we need, and we're going to put a lot of these larger footprint clinics where our members are, and it's all driven to help us control cost.
Okay. I'm really interested in, this aspect of the business now because, I mean, if I'm going to take an outsider's view of the business, so bottom line is that you want for your customers to pay less for their healthcare. By coming up with your own clinics, you therefore now control, and hopefully, if you bring it to such a scale, control the manner by which you deliver and charge, I guess, internally, how much that test or that procedure would cost,
Yeah,
which translates to savings now on
absolutely.
your part, also therefore bringing down the cost of
Yeah, the utilization.
exactly, the utilization. Now,
Absolutely.
the math makes sense. In the greater scheme of things, how does that now position you in the healthcare space, knowing that you are now, in a way, competing against
With our providers.
exactly. So it's very interesting how that now plays a role in the
Okay,
future of
this is
Maxicare.
this is how I'll answer that question, John. I believe it's up to our members to decide for themselves. In the past, the hospital was always the first place. Hospitals, emergency room, and clinics. Yeah, maybe if it's just next door to where I live or whatever. But ultimately, they will begin to see that if we can provide the same, if not better, level of service from our own clinics, which are conveniently located where close to where they live, close to where they work, why not? Right? But ultimately it's their call. And what's happened since the pandemic or post-pandemic is that the medical inflation, the cost of healthcare in private hospitals, it has really gone up. And ultimately, if you are in a corporate plan, your company may decide that, oh, we're spending too much, or it's too expensive, and um, maybe the HR people will say, you should. There's a Maxicare clinic not far from where you live. Maybe you should maybe go there. But again, it's a mindset.
Right.
It's a difficult. Filipinos, right? When they really have this mindset of a particular way they should handle a situation, it's hard to switch them, no?
Right.
Until of course, eventually they'll say, "Oh, pwede pala," right? Or mas
Yeah.
maganda to,
Yeah,
no?
and can you imagine, because we have AI now, eventually maybe, I don't want to say that doctors will be obsolete, but right now, I mean, I'm just talking from experience. My wife consulted ChatGPT on something, and it's just mind-boggling what she was able to get as advice for something that normally you would have to go to a doctor or a hospital or a clinic for, right? So, are you scared or are you happy? Are you optimistic with how technology now is playing a role in, well, at least on that side, right? The actual, you know, having to seek out a medical professional for I guess a diagnosis or advice.
Oh, okay. I I have not attempted to use AI to determine whether if I feel a stomach ache or if I think I know what my symptoms are. And of course, you can't blame people. It's just the nature of the way things are now, right? That is an enormous challenge because we have extremely capable, competent, and good medical professionals. I always tell people, look, I know if you feel something, you want to check it out, you're lazy to whatever, or go. But I always say, look, at the end of the day, go see a medical professional. Just that's what they're trained to do, right? Now, I'm not saying that you can't use AI, but for me personally, I'm still trying to understand how we might be able to use it ourselves internally, right? To help our members when they have a consultation. Because as you know, we've said this earlier, right? The when we have our members have access to teleconsulting. So they can pick up the phone in their phone, they can speak to a doctor directly, which is of course what they prefer, right? To see a person. So I'm trying to figure out or trying to understand really. I all a lot of this whole AI thing is fairly new to me myself. So I'm not sure how or where we might be able to harness the power of that and in a way that will benefit our members and the company as well.
Yeah. Well, apparently in some parts of the world, it's already like quite normal for people to be able to at least on the at the onset find out what's going on with them. And there are also in some countries some people who are actually more comfortable knowing that a robot will undergo their procedure in place
Of
of
a human.
a human doctor. So it's a very interesting time that
It
we're in
is.
right now.
It is.
You know, I think from back in the 80s when Maxicare started, and obviously right now you have really great leaders in your organization. You know, I'm confident that I'm actually quite excited with where your industry is headed and how much of an impact you can even make knowing now that we have all these tools that can help us. You know, I just want to find out from you. I mean, as someone who has yourself been someone who has struggled with health, you're a cancer survivor. I'd like to get your perspective on you yourself having gone through a medical scare
Hmm. Hmm.
and positioning now your company to for the future.
Yeah, yeah.
Um,
Sure, sure.
could you share with us your thoughts as someone, as a human being who I guess was at a point in his life where you might have thought, what is next, or is this it? And what I guess my question is, what is going to be your legacy towards, you know,
Okay. Now that you put it
your
that way,
yeah.
interesting. Yeah, the all of those my health situation as I went through and as I continue to go through. The one thing that I would like to, if people in conversations like this, you know, with people, is like you and I, are the ones who should decide about our health. At the end of the day, it's up to you to decide, is this what I want or is this what I. And of course, there will be pressure, right? There will be pressure to adhere to what, oh, the doctor said I should take these pills for the rest of my life, right? And you know, you may believe that, no, I don't really want to do that, right? What is the alternative? So ultimately, it's really your call. It's really your decision. And you got to take control of your health. That phrase, right? We like to say health is wealth, right? It's more than just a phrase. It really is an opportunity for you to take control of your own situation and what's best for you. What I've tried to do moving forward in a small way, because as I said, I'm not really involved in management of Maxicare on a day-to-day basis, is that I'm working with our team members who are in the health and wellness focus and trying to introduce preventive measures as opposed to post chronic situations, right? In other words, what can we offer our members beyond just being there when they're already sick, right? We can offer them, and there was a time we were doing this in a smaller way. We were doing webinars.
But now it's more deliberate.
Yeah, I'm trying to, because ultimately, if we want to, if for the benefit of the company, the plan has to make sense, right? It has to, the economics have to work, and all of that. And of course, it's very very different. So I would like to leave that if I could, as in the same way that my father started the company, and his legacy was to make the healthcare affordable. I would like to believe and that I might be able to contribute by telling people there are alternatives. You don't have to wait until you're completely sick and you have to go into the system, where in a lot of cases for our population, it's not affordable. They have to run to friends and family. They have to go into debt, and it's not a good situation. I mean, they're already suffering, right? And then there's this other burden of having to deal with that aspect. So there are ways, but it requires again, another marketing change, a mindset that you control your own health. You can get all the information available out there, and but ultimately you have to decide, is this what is best for me? You don't want to wait until you're in that situation, right? You can start now. I started when I was 7 years ago, roughly, and I feel good most of the time. And my decision to go whole food plant based was one of the best things I ever decided. And I encourage people, who want to try it, and who want to. There's just endless info, and there's just really a lot of good people out there who are offering very sound, very very solid advice, and which is why I tell friends and whoever I have a chat like this about, is that you must take control of your health.
Right. Bobby, having heard you say what you just did right now, I think it's such a beautiful thing to witness how you, at one point in your life getting cancer, actually shaped your outlook on, having that same journey or going through that same thought process, having that shape now what is the future of this big organization. I think as human beings, we're designed to look at the silver lining and the positives of the things that happened to us. I think in this case, maybe cancer was something that was given to put your mind in such a place where I think it can possibly impact millions of people. I think, and I am with you when you say that, prevention is really the key. That's why I myself have undergone this, I would say, transformation in the way I think as well. I mean, I'm in my mid 40s, but I am so much more cognizant now of the fact that I am no longer young. And I have to start thinking of the time when I won't be able to do the basic things that I do now and take for granted. I think it's such a beautiful thing what happened and how it affected the way you think, and you now pass it on. I think this
Yeah,
this
I'm
legacy of
hoping to.
yours
Yeah,
is very
it's
important.
and I'm hoping to do it here through Maxicare, if that's possible. Because really, health is wealth, right? I mean, you can have people say it all the time. You can have all the money in the world, but if you're sick, or if you're not, et cetera, et cetera. And I think once people embark on this journey, and the effects begin, they'll start feeling really good. I mean, physically, mentally, that's worth a lot, right? I mean, it's not for anything. It just changes your perspective on things, and ultimately, it just helps helps you go through life knowing that you're in control. That's what it's all about. Just taking care of yourself, and living a what is that phrase they use, a your health span. No, you mean you want to grow as we age. You don't want to be getting sicker, right? You want to be able to enjoy your 70s, your 80s, even your 90s. Yeah, it's not impossible. You just have to kind of focus on what it is you want to accomplish as far as your health is concerned.
Well, Bobby, always a pleasure to talk to you. The last time we talked, I think I learned so much, and now I think knowing and understanding now your legacy that you leave behind with Maxicare, I think it gives me a greater appreciation for the things that are happening now. Given a lot of thought into how you can translate what you went through, and have it make sense not just from a business perspective, but to be able to help more people. live better lives. So I thank you for that, Bobby, and
Thank you, John.
thank you
I appreciate your
for
conversation.
thank you so
Thank
much.
you.
So that was Bobby Macasaet, chairman of Maxicare. Thank you, Bobby.